name is Abhishek Mangaonkar, and I'm an assistant professor in the Division of Hematology at the Mayo Clinic in Minnesota, United States. I'll talk about the different types of leukemia that patients can be diagnosed with. There are predominantly two types of leukemia. Leukemia is a cancer of the white blood cells, and there are different types of white blood cells. And depending on the origin of the white blood cell, or essentially where the leukemia starts, and which cell it starts, the leukemias are classified into two broad categories: the myeloid type, where the cell of origin is granulocytes, this granulocytic lineage, which means these are the cells that make neutrophils. And then the second version is the lymphoid type of leukemias, where the cell of origin is basically matures into lymphocytes. Broadly, both of these subdivisions of leukemias can be divided into acute and chronic. Acute is where it's a lot more aggressive disease. The symptoms are more severe, and it's a more emergent situation to treat such patients. And the distinction between acute and chronic is often made by the percentage of blasts in the bone marrow, with more than 20% being diagnostic of an acute leukemia. My specialty is primarily myeloid leukemia, so I'll talk about myeloid leukemias briefly. Acute myeloid leukemia is a life-threatening illness and needs to be treated urgently, oftentimes in the hospital. Chronic myeloid leukemias are, in general, more insidious and indolent. However, there's a certain fraction of patients with chronic myeloid leukemias that can transform into acute leukemias. Chronic myeloid leukemias in general are divided into two categories: myelodysplastic syndromes, which is where the cells are dysfunctional, they're dysplastic. And the other version is myeloproliferative neoplasms, where there is an increased production of blood cells. There's also a third category where there's an overlap between myelodysplasia and myeloproliferative neoplasms, which is called MDS-MPN, or myelodysplastic syndrome, myeloproliferative neoplasms overlap syndromes.